To all healthcare professionals and policymakers, imagine someone arriving at your emergency department, not for a medical crisis, but because they have nowhere else to turn. This is a reality we cannot ignore. How do we, as a system, respond when patients are medically cleared but have no safe place to go? The answer reveals a hidden crisis in our hospitals. This is the growing challenge of social holds, a deeply human issue that leaders like Amanda Shrout, DNP, RN, at LifeBridge Health in Baltimore, are urgently working to address. At LifeBridge Health, every social hold is closely tracked because each one represents a person in need of compassion and support. Last year alone, 20 patients remained in the emergency department for over 7 days, not due to medical necessity, but because there was no safe discharge plan. These are not just numbers, they are lives in limbo.
Dr. Shrout reminds us, no patient should ever have to stay in an emergency department for more than 7 days. Ever. In any situation. This is a call for urgent change.
Yet, for many hospitals, this heartbreaking scenario is becoming increasingly common. The impact on children is especially profound. Imagine the fear and confusion they must feel. At LifeBridge, many minors are brought to the ED by police or guardians, not because of a health emergency, but because they have nowhere else to go. These are children caught in the gaps of our system. After their immediate medical needs are addressed, these children often face days of uncertainty, waiting for a safe place to call home.
Dr. Shrout shares the story of a young boy left alone after both parents were detained. He arrived at the hospital not for treatment, but for safety, a stark reminder of the system's limits.
Though he needed no medical care, the hospital became his only refuge. His vulnerability is a call to action for all of us. Social holds disrupt more than patient flow. They strain resources, delay urgent care, and place immense emotional burdens on staff and patients alike. With respiratory virus season approaching, the stakes are even higher. Every bed occupied by a social hold is one less for a child in medical crisis.
As Dr. Shrout says, we worry about these long-stay children in our emergency department, especially when new patients arrive needing urgent care. The concern is real and immediate.
The emergency department's chaotic environment can be overwhelming, especially for children with behavioral or mental health needs. We must do better for them. Dr. Peter Pronovost of University Hospitals in Cleveland warns that such settings can worsen conditions like anxiety and autism, compounding the harm.
For someone with a behavioral health issue, he explains, the emergency department can be the very place that triggers their distress. We must recognize this and act.
LifeBridge Health employs child life specialists to create daily routines and activities for children in social holds, striving to bring comfort in a difficult situation. But living in an emergency department, surrounded by constant noise and bright lights, is far from ideal for children who don't need inpatient care. We owe them better.
It's not enough, Dr. Shrout admits, her voice heavy with concern. We are healthcare workers trying to ensure safety, not parents or guardians. Our system must do more.
So how can we, as professionals and policymakers, better support those caught in social holds? The answer requires urgent collaboration and compassion. Is there a more compassionate way to bridge the gap between hospital discharge and a safe, supportive environment for vulnerable individuals? We must find one, together. This challenge is not just logistical, it is deeply human. Let us work to ensure that everyone, especially our most vulnerable, has a place to truly call home.